Hello everyone, I am Dr. Navleen Khurana, an anesthesia resident in SMS Hospital, Jaipur. And I've been working in the COVID ICU since past 1 year. Today I thought of making this video so that I could share some important and valuable information with all of you. So basically COVID-19, you can divide this illness into two phases, phase 1 and phase 2. Phase 1 is the first 5-6 days and phase 2 is the next coming 5-6 days of the illness. So the day when your symptoms start, like fever, sore throat, loss of taste, smell, myalgia, or the day you come COVID positive is the first day of your phase 1. That is when you start your medications like ivermectin, doxycycline, Fabiflu, vitamin C, Zincovit, and azithromycin. And there is no need of panicking. All you have to do is take these medications and take adequate fluid and plenty of rest. The moment that you need to be careful is the 6th day of your illness and the next coming week, because that is where the complications arise and that is where people generally end up in hospitals, the second phase. So the time that you need to be careful is from the 6th day of your illness, where you should get a CT scan done and inflammatory markers done like CRP, CBC, and IL-6 and D-dimer-2 if possible. So if your CT scan score is mild and if your inflammatory markers are normal or only mildly elevated, there is no need of panicking. But if your CT scan score is moderate to severe and if your CRP levels are elevated, you should immediately consult the physician and start treatment. And that is the time when you should start steroid and blood thinners. But I strongly advise you not to self-medicate yourself. This should be only under the guidance of a physician. But the problem is that when a fever starts resolving on the 4th day, 5th day, we tend to think that we are fine and people start and resume their normal activities and do not take much rest and stop checking their saturation levels. So it is the 6th or the 7th day when your saturation actually starts falling. And you might be doing your normal activities, but on the 8th or 9th day, a patient might suddenly collapse or feel weak, or they might be dizzy and might turn blue. That is when your saturation is suddenly dipped and you might be rushed to a hospital. So there is a term called as happy hypoxia, where your oxygen saturation has fallen down to 80-85% or 85-90%, but you're absolutely normal and you're working, and then the person suddenly deteriorates on the 8th or 9th day and ends up in the hospital needing oxygen or ventilator. So basically you need to be careful from the 6th day onwards. That is when you need to start checking your oxygen saturation every 3 hours and you need to be on proper rest. You should also take a 6-minute walk test where you should walk for 6 minutes and then check your oxygen saturation levels. If your saturation falls 5% or more than 5%, that means your lungs have been involved and you definitely need to seek medical attention immediately. So it's basically this phase 2. If we follow the proper timeline of COVID, if we are careful after the 5th or 6th day and if we take proper medications, we can totally prevent these complications and we can reduce mortality. So you should please share this valuable information with your loved ones, with your family members and relatives and those who have less access to online social media platforms, so that we can help save as many people as possible. Thank you.